All right. So this is Gina. Now, how old are you, Gina?
29.
Okay. 29. How old's your husband?
32.
Okay. And both of you were on high blood pressure medication.
We both were on high blood pressure medicine. I was on it for, mine started with the birth of a baby. And it was, I guess, almost 8 months, 7 months, I guess. Mm-hmm. And he was on it for, after 1 month, they put him on a low dose, and after 1 month, realized that it wasn't high enough of a dose, so they doubled it. And then we met Dr. Pompa, and we actually, we felt so motivated that we went ahead and started the diet.
Before this.
Before this, we haven't, you guys are way ahead of me, because I haven't even attended the seminar. I've listened to his CDs. And, of course, I'm a chiropractic patient, so I'm in the office and I hear things and I learn things. But we were so motivated that we started the healing diet just because we wanted to see, what kind of results we could get from it. And after a week, I was off of my medicine. My husband was off after a week and a half.
That's it. There's testimony to age there, too. But, yeah, absolutely. But, and I know, you had testified that, so many things changed, not just the fact that you were off your medication. But I think the thing that should be pointed out is what was your discussion with your doctor? They weren't so excited. Right.
Yeah. I had been to several different doctors. Mine started with preeclampsia. And typically when you have preeclampsia, when you give birth to the baby, your blood pressure dips and it is normal. Everything is back the way it's supposed to be. And mine did do that. It dipped. And 2 days later, it rebounded, and they weren't able to stabilize me. I actually stayed in the hospital for 11 days. And I came home on an extremely high dose of 2 different medicines. And what was your question? So I had been to several different specialists. The OB doctor had sent me onto a nephrologist, which is a kidney specialist, just trying to get to the bottom of everything. And pretty much then on to the primary care physician and on to some other doctors, and pretty much they all said, we really may not ever know what the cause of your high blood pressure is. We really can't figure you out. You're a medical mystery. And
so they had planned on putting basically her and her husband on these medications for life.
Yeah, they said you'll probably just need to be on this medicine for the rest of your life. Well, I wasn't accepting that. And
well, anyways, yeah, she did the diet. I think the thing that should be pointed out, because we said, what inspires people, what inspired Gina and her husband were the fact that, they're in their 20s and early 30s, and they were already put on medication for life. The sad thing is that some people just accept that, and that's really the disturbing, part of it all. Is that, modern medicine has boxed people into realize, just saying, okay, well, I'm just going to do what they tell me to do because they said so. And, it's hard to fight against that. And when you called up, I remember you telling me you called your doctor and said, I'm off my medication. And they said, you need to make an appointment.
We need to see you right away.
We need to see you right away. Mm-hmm. And how many times have I heard that? They just basically want you to get back on the medication. And, it's sad. But you know what? It's like, and you'll hear me say this the last class, we have to set ourselves free, from certain things in life. And really, the medical, allopathic medicine is holding many of us in bondage. Like I say, it works great in emergencies, but the problem is that when we start getting on these medications, then you need a medication, then another medication. You have to understand that we represent, 4% of the world population. We take 72% of the drugs in this country. That's bondage. Now, the argument would be great if the fact that it was working. In other words, if we didn't lead the world in degenerative disease, then maybe we're onto something here. But the fact is we lead the world in degenerative disease. It's like there's no way a 29-year-old girl, healthy girl, should be on high blood pressure medication for the rest of her life. Guys, it took 1 week just getting rid of the cause of the problem. 1 week. And it took her husband 2 weeks. So thank you, Gina. I appreciate it. Yeah.
And my dad.
Oh, yeah. Tell them about your dad. That's right.